Hi, I'm Prasanadu. Today we are discussing about calcium. So, total body calcium is 1 to 1.5 kg and 99% in bone, teeth and 1% is fluid and tissues. Source, first of all, what is the major source of calcium? Milk is a major dietary, like dairy products like egg yolk, fish, egg peels, and cow milk is 100 milligrams per 100 ml, and human is 30 milligrams. So recommended daily allowance is adults is 500 milligrams per day, children is 12 milligram, 1200 milligrams per day. Pregnancy and lactation will necessary more requirement and food. That's why 1500 milligrams per day. So absorptions of sites. So first and second part of the duodenum calcium absorbed against the concentrations of radiance requires the energy and a carrier protein. Like factors affecting increase the absorption rate like calcitriol, parathyroid hormone, and acidity, and amino acids like lysine and arginine. So these are the some factors decrease the absorption rate. So that means decrease the absorption rate. Phytates, oxalates, and high phosphate phosphate contents optimum ratio is calcium up to 5 phytates phosphate content is 1.2 to 1:2 to 2:1. So free fatty acids like calcium fatty acids, insoluble calcium soaps like steroids, steatoregia, like alkaline medium, and high dietary fibers. So functions like mineralizations of bone and teeth. Bone is a mineralized connective tissue. It contains organic and collagen proteins and inorganic minerals and components. Hydroxy peptide. So coagulations of blood. So calcium is a factor 4 in coagulation cascade, and prothrombin factor 2 contains glutamate, gamma glutamyl carboxylate these things and residues. And calcium forms bridges between the glycogen residues and prothrombin and membrane phospholipids of platelets. So how activation of enzymes? Calmodulin is the calcium binding regulatory protein, molecular weight like 17,000. So calmodulin can be bind with 4 calcium ions. So mechanism of calcium. So calcium plus calcium with mediated with the calmodulin. So some of the mediated by the calmodulin like adenosine cyclase and calcium dependent protein kinase and calcium magnesium ATPase and glycogen synthase and phospholipase C and phosphorylase kinases and pyruvate carboxylase and pyruvate dehydrogenase and pyruvate kinase. So some of the adenyl cyclase and calcium and glycerol 3 glycogen synthase. These are the mechanism about the calcium mediated by calmodulin. So some nervous function like calcium is necessary from transmission of nerve impulses from the presynaptic to postsynaptic region, and some other functions like secretions of hormones like calcium mediated secretions of insulin, parathyroid hormones, calcitonin, vasopressin from the cells. So some of the second messenger signal transactions. Important function is here calcium is regulate the cyclic AMP second messengers like different hormones. One example is glucagon. So calcium is used as a second messenger in the systems involving G protein and inositol triphosphate. So coming to the myocardium, in myocardium calcium prolongs the cytosol and hypercalcemia, cardiac arrest is seen in the systole and causing when calcium is administered intravenously, it should be given very slowly. So some normal ranges is mainly 9 to 11 milligrams per dl. So ionized calcium is 5 milligrams per dl. Calcium complex with the phosphate rate is 1 milligrams per dl, and protein bound calcium is 4 milligrams. Ionized calcium is metabolically and biologically active form. So hyperalbuminemia results in the decreased plasma total calcium levels. Each 1 gram albumin increases causes and decreases the calcium levels, and hypoproteinemias and associated with the increases the plasma total calcium levels. Acidosis favors the related it releases the ionized calcium. Alkalosis is a favors the binding calcium of and decreases the ionized calcium levels, but totally calcium is normal. So calcium homeostasis, how regulation of like how maintain the calcium levels in our body. So majorly involved in the calcium homeostasis is calcitriol, parathermone and calcitonin. So these are the three mechanisms: calcitonin, calcitriol and parathermone, secreted by the chiefs like a parathermone. Coming to parathermone, parathyroid chief cells, it releases the parathyroid hormone is mediated by cyclic AMP. Three independent sites of actions they are bone, kidney and intestine. All three actions of parathyroid hormone increases the serum calcium levels. So some of the bone demineralization and decalcification induces the pyrophosphate soluble calcium, some of the reabsorption of bone. So how it regulates. Coming to the kidney, parathyroid hormones is direct actions decrease the renal excretions of calcium. So mainly by the increased reabsorption of calcium from a digital and decreases the phosphate excretion. So intestine parathyroid hormones stimulate the 1-alpha hydroxylate 25 hydroxycholesterol cholecalciferol, and it forms the calcitriol. Calcitriol induces the synthesis of cal binding. So this cal binding increases the calcium absorption, forms the intestine, thereby increasing the calcium levels in blood. So calcitonin, coming to the calcitonin, it secretes the proliferatory cells of thyroid. Calcitonin is promoted calcification by increasing the activity of osteoblasts. Calcitonin decreases the bone reabsorptions and it increases the excretions of calcium in urine. Overall, it decreases the blood calcium levels. So some of the relations about the calcitonin, calcitriol and parathyroid. Importance of calcium P ratio, phosphate ratio, it is the normal adults is 40 and children is 50. Normally calcium and phosphate ratio is essentially bone mineralization. So hypercalcemia. So hypercalcemia means that levels is increases the calcium level in above the normal range, that means 9 to 11 milligrams, that means increases here. So how it will be, what are the conditions, what are the symptoms, what are the criteria here we will show about the, here is hyperparathyroidism. So this hypercalcemia, one of the conditions is hyperparathyroidism. That hyperparathyroidism is characterized increase the serum calcium levels, decreases the serum phosphates and increases the alkaline phosphatase activity. So second condition is multiple myeloma. So that conditions increases the hypercalcemia levels. Some clinical features we will observe here. The clinical features coming to neurological symptoms and depression and confusion and irritability. Generally muscular weakness, and coming to GNT, anorexia, abdominal pain and nausea or vomiting. Coming to CVS, cardiovascular system, is cardiac arrhythmias. Coming to the hypocalcemia levels, that means decreases the normal level, normal range is 9 to 11 milligrams. So decrease means that means 8 or 7 like that. So whenever decreases the serum calcium level 7 less than 7, that condition is 7 milligrams per day. So that condition is called tetany. So causes the accidental surgical removal of parathyroid gland parathyroid. So pseudo hypoparathyroidism, lack of and end organ response, renal disease, liver disease, vitamin D deficiency. These conditions are decreases the vitamin D levels and calcium, and also decreases the calcium hypocalcemia. Some of the conditions like malabsorption syndrome and renal risk, osteoporosis, and clinical features like tetany is neuromuscular irritability and spasms like laryngeal spasm lead to death and convulsions and muscular cramps. ECG, QT is interval increased. So QT is increased. So this about the calcium regulations and source RDA, functions, normal ranges and abnormalities of calcium. So we'll discuss about the calcium metabolism.